So after finishing reading Chapter 6, Federal Efforts to Enhance Quality of Patient Care, just to give us a concise, brief summary of the chapter, it's about federal legislation and how the government has influenced programs to push the progression of EHR use among hospitals and healthcare practitioners nationally. And so, under the HITECH Act, the federal government established incentives or ways to fund the support of widespread adoption for EHR use among hospitals and healthcare providers nationally. And so, what the HITECH Act did was establish incentives for Medicare and Medicaid incentive programs. And so, we can see on page 182, table 6.1, we have a list of Medicare and Medicaid incentives for the push of EHR use. And so it is slightly different because, as we said in a previous lecture, that Medicare is a insurance company, more so targeted for a patient population 65 years and older, whereas Medicaid is a aid assistance program for people that are disabled. And so the purpose of having these incentive programs is to convince healthcare professionals and hospitals to make major changes that would be safer for patients and more convenient for the beneficiaries of Medicare and Medicaid. And so this is just to set up a more standardized way of collecting patient information for the government, um, essentially for the Medicaid and Medicare beneficiaries. And so what the government's trying to do is push or take the use of paper documentation and really try to push the progression to EHR use so that collecting information is more standardized among hospitals or doctors, and it's safer, less errors, reduced costs, and it's just more bene- beneficial in general. And there are also non-financial incentives that high tech has, such as the Regional Extension Center that provides IT assistance to providers that don't have a strong IT background. And so this is just to help those providers have an easier transition from paper documentation to um, electronic use. And the chapter also talks about in 2010, when Affordable Care Act was passed under the Obama administration, there was even a bigger push and emphasis on creating newer models and EHR care and delivery use in hospitals and healthcare and with healthcare practitioners among the nations, because this would essentially lead to better patient outcomes and reduce healthcare costs. And so this chapter we focus on two models of healthcare, ACO and PCMH. And so ACO is also known as Accountable Care Organizations. This model focuses on the use of um, having a network of physicians and other providers who work together to improve patient care or patient outcomes for a set defined patient population. And the other one, PCMH, also known as patient-centered medical homes. This model focuses on having the relationship between the patient, healthcare provider, and patient's family. And this is a model based on that relationship to reduce healthcare costs and improve healthcare quality for the patient. So both models, ACO and PCMH, both need IT support to have the success of these models, And so some examples of functions that IT does for both programs are identifying and maintaining costs, adhering to evidence-based guidelines, managing entire patient populations, and reduce patient costs and improve outcomes. And so essentially the goal of having all of this EHR push or transition and pushing for health information exchange, also known as HIE, is to really improve patient outcome, reduce costs, and have a more standardized and easier way for the government, for example, here, Medicare and Medicaid, to really have a more standardized way of collecting patient information. And so the chapter also touches about health information, health nationwide health information network, which also pushed for a standardized set of standards to promote HIE, also known as Health Information Exchange. Also, the ONC, Office of National Coordinator, funded 56 states and regional HIE programs to promote the use of HIE among the nation. And so from the chapter, we really see the push of federal government in trying to have hospitals and healthcare providers transition from the old way of paper documentation and transition into the use of electronic health record.